My name is Dr. VanSchoor. I am a senior lecturer at the University of Pretoria in South Africa, and I studied the basic medical sciences, which is just a BSc degree, went on to honours, masters and a PhD in anatomy. So I'm a purist in that form, that I actually studied anatomy as a science to become an anatomist. The McMillan and Abrams Clinical Atlas of Human Anatomy, the 7th edition, it's an epic textbook. It's already got a sort of a following of its own. If you just mention the term McMillan in our institution and everyone immediately knows, oh, it's the atlas where they've got real dissections. So immediately it's a step above all the other. Not a step above, it's not better in any way necessarily, but it is something different to the other atlases. Often students would ask me, what atlas should I get? And I say, well, it really depends. If you just want the pictures and you want to find the structures, you can get any one of the normal atlases that you find out there. But if you want to see what it really looks like, what the dissection looks like, if you want to see that the human body isn't red and blue and it doesn't have very nice lines, and it curves, and it's small areas, and it's an interesting and a varied sort of area, then get the McMillan and Abrams, the new one, atlas, because in that sense not only do they get a sense of how varied the body is and how the actual anatomy and the positions of the structures are, but they can really go back after the practical or before the practical, and they can see, okay, this is what I should be seeing, or this is what I should have seen, and this is what it would look like. So I find the atlas to be unique in many ways, and I really hope that the students find it to be helpful. I was fortunate enough to be involved in this project through Peter Abrams, who took over from McMillan quite a few editions ago, and he's been taking this further and further with every edition. So I was very fortunate to be involved with this, and we felt that with the 7th edition, that not only should we look at all the structures that's either missing from the 6th edition, or which dissections could be put in a better light, could have a better view, could have more structures, better structures, and orientate the specimens to the best of our ability. So in this way, we're trying to evolve this book to become the definitive sort of atlas for anything that you want to do, for not just for the first year medical student or the first year medical science student, but also for the specialist who's constantly trying to learn, constantly sort of increasing his knowledge in anatomy. And another thing that Peter Abrams got in, and he got myself and the other co-authors involved with as well, is adding the clinical cases. And these are clinical cases that we've been getting them for decades now. Peter Abrams and a lot of people have contributed to the clinical cases, the clinical pictures. Myself and Marios Lucas and Jonathan Spratt, they also got all their a lot of clinical cases from our side that we added to the textbook. There are some small text, some background on every case. And these clinical cases can also be used in presentations by an educator to give the clinical relevance to a student. So not only is it beneficial for the student that can learn from it, but it's also for the educator that can use the material to try and teach the students.